So how do we rebuild this all-important trust? Joining us now to discuss, Dr. Ayla Stanford. She's a surgeon who started the Black Doctors COVID-19 Consortium at the beginning of this pandemic to provide testing and care to those in the Black community without insurance or access to quality health care. And Darren Walker, he's the president of the Ford Foundation, a philanthropic organization dedicated to fighting inequities. Since this pandemic began, they have focused their efforts on the hardest hit communities. He is one extraordinary American. You both are. Dr. Stanford, I want to start with you. Yesterday, you got the vaccine. After months of testing and treating COVID-19 patients, what was that moment like for you?
It was very emotional. I had some fear, but I had already made the decision that I was going to do it and set an example, because so many people had said to me, Doc, when you tell me it's okay to get it, I'll get it. When you say it's all right, I'll roll up my sleeve. And I realized that it was less about me and more about everyone else that doesn't have the access that I have.
How and why did you have those fears, those reservations about taking the vaccine? You are the expert. When we see you take it, it gives us a lot of confidence. Why were you concerned?
Because before I was a doctor, before I was a surgeon, I'm a Black woman. And culturally, that is almost a norm. It's how we were raised, that you go to the doctor when you're really sick and you think you're about to die. But other than that, you don't go. You don't trust because of the past experiences that have happened. And so science me was listening to the EUA hearing, reading everything I could get my hands on. But Black me was like, I'm not sure that I'm going to do this. And when I contracted coronavirus, I had antibodies, and I still do. And my doctor and I have been following my titers, and I decided I wasn't going to get the vaccine until I no longer had IgG. And I think that was my trepidation and fear. And the more people said to me, when you tell me it's okay, Doc, I'm there, it became less about me and more about all the African Americans that are dying and have a disease greater than any other group in this country. And everyone can't get their antibodies checked every 4 weeks like I can, and then say, okay, now I'm ready for a vaccine. And so that may have been good for me as an individual, but it wasn't good for the masses of people that we're trying to serve and provide access for. And so that's what changed my mind.
Darren, is one of the reasons there is so much mistrust in the Black community simply because the system has always failed them, especially during this pandemic?
Absolutely, Stephanie, and thank you for your consistent coverage of this issue. It's so important. The reality for most African Americans is a narrative, a history in this country of inequality in all of our systems, and in particular, our healthcare system. So in addition to the experimentation without consent, the ways in which we have been exploited through the healthcare system, we have come to a time in this pandemic when all of this has converged. What the people who were we just saw were saying is that we are always last in line, and we are most likely to be the very workers, those essential workers who are poorly paid, who don't have benefits, who don't have access to health care. And all of that has converged in this crisis with monumental detriment to the African American community.
Obviously, philanthropy is so important in this country. It's extraordinary, the work that you do. But this pandemic has exposed inequalities that you have spent your career focused on. Is there any sort of silver lining, Darren, that you believe that now, once we get through this, our government will finally see this as a call to action and address all sorts of health, income, housing, education inequalities?
I think this year, the silver lining is that the inequality of race, the racial caste system that is manifest in our economics, in our systems of education, healthcare, housing, and criminal justice are stark different for most white Americans. And so for African Americans, for Latinx Americans, for the first time, we believe that the reality of our lives is no longer deniable. The racism that exists is no longer deniable. But Stephanie, what we have to also recognize is what you talked about earlier. 8 million people have fallen into poverty this year during this pandemic. While that was happening, people like you and me who have assets, who have real estate, have seen our net worth increase significantly. There is something wrong in a nation when in the midst of a pandemic, those of us who are privileged, our privilege is compounded. Our bank accounts, our investments have been compounded, while those essential workers, those African Americans, Latinx workers who are on the front lines, their disadvantage has been compounded. So you know who ought to not be in line right now or thinking about being in line right now are people like me and you, because we are privileged in this system. And as Dr. Stanford knows from her work, people like us have no reason right now to be thinking about getting in line.
I am so glad you brought that up. We have no reason to be in line, but Dr. Stanford, you know people of privilege are. They are talking to concierge doctors. They are pulling every string they can to get this vaccine. What do we do to stop that? I'll tell you, 2 weeks ago when I had the COVID vaccine, it was a whole lot easier for me, a person of privilege, to get myself a rapid test than people in a different situation.
Right. So I believe, for example, I'm on the vaccine.
Test, not vaccine.
Yes, the Vaccine Advisory Committee for Philadelphia Department of Public Health. And I have to be a voice. I have to be an advocate. The American Medical Association, the National Medical Association, the Historically Black College and Universities, and for that matter, the non-historically Black colleges and universities have to be the advocates and stick to the criteria from the CDC about phase 1A, B, and C workers, and that you don't enter that criteria until it's your time. The other thing that I would say is that the phase 1A and 1B, remember healthcare workers, of the 63% of healthcare workers who died, most of them were of color and the majority were African American. So that does represent us being in that first group. But what hospitals have to make sure they include, and I heard your previous guest mention this, is that it is the folks emptying the garbage, transporting patients, bringing people food. The security folks at the ER, they are equally exposed to the coronavirus and they should get the vaccine. And Darren, what you mentioned, the experience that African Americans have had with the healthcare system being untrustworthy to them, I agree. I know the history, but we cannot allow that to impede us from receiving help that is on the way. It's here.
And that is why we need people like you to speak up. We need prominent validators like you, doctor, who are respected in our community. And when we hear more people like you saying, please get the vaccine, you will see the numbers go up.
Yes, that is my fervent prayer.
And I am so fortunate, and our audience is so fortunate to have both of you joining us today. Dr. Stanford, Darren Walker, thank you both so much. And a reminder for you at home, if you need help, ask for it. But if you can give help, please give it before the end of the year. If you're one of those people Darren was talking about, someone who has assets, someone who saved more than they normally do this year. Many people actually saved more. People who worked from home, who weren't paying to commute. If you've got some extra money, think about charitable giving right now before the end of the year. America needs it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.